To round out our most common cause of hepatitis, though, so we talked about alcohol, we talked about viral. Those aren't the most common cause, especially here in the United States.
Not anymore. Not anymore.
Sadly. So we're going to talk about something called MASH, Metabolic-associated steatohepatitis.
Yeah, metabolic dysfunction-associated. Yeah, steatohepatitis. Yeah, really before it was just non-alcohol. So it's like, okay, you're not a drinker. This is what you have. But really, with the obesity crisis and metabolic syndrome and all these things becoming more prevalent, it needed a name update. And it's a mouthful, but that's why we're going to abbreviate it here as well. And so basically it's related to having metabolic syndrome and obesity causing liver disease.
So who's at risk for MASH?
So really anyone with obesity, type 2 diabetes, insulin resistance, kind of the same thing we see with high cholesterol or triglycerides. If you had high blood pressure, and there is some correlation too with like polycystic ovarian, which I know is a little bit of a complicated correlation. And then of course, sleep apnea as well. So those are all risk factors, kind of same risk factors we see with all obesity related diseases.